It's one of our busiest times of the year when we start our vaccination programs for both seasonal flu and then, of course, everyone's well aware through the media that we have a second campaign this year dealing with the H1N1. So we will be currently right now we are working with our seasonal flu program. We are dealing with those that are 65 years and older, those that are 65 years and younger that have a chronic medical condition. We're dealing with children and, of course, our pregnant women and, of course, our healthcare workers. With the H1N1, it's a little bit different rollout for a couple of reasons. One, they've done a different prioritization of who's going to get the vaccine first. There's also an issue around the supply. Not that there's not going to be enough supply, it's just the way they have to roll it out for the manufacturer to keep up to the demand. There's a small delay in when we'll be getting all our vaccines, so we have to be careful how we roll it out. So with the H1N1, we will be rolling it out to our healthcare workers first. We're going to focus on them for the next 2 weeks. Part of our justification to that is that we have to be able to keep our facilities operating. Most facilities or most businesses have to plan for a 15 to 20% reduction in human resources. We have to plan for that as well as an increase in people seeking services. So we need to make sure that we have staff well and available to help those people. So that's why we're focusing on healthcare workers first. We'll do that for the first 2 weeks, so this week and next week. Following that, we're going to do a select group of individuals in an area where we have some hot spots. Currently in our southwest corner of the region, we've been dealing with some sporadic outbreaks and some very increased activity around influenza-like illness. So we will be focusing on those groups, so that being the Maple Creek, Leader, Shaunavon, East End area. By the 16th of November, though, we hope to have enough vaccine on hand that we'll be able to roll out in swift current. The reason that we're staging it the way we are is we really would like to be able to vaccinate everybody that comes in the door without having to turn somebody away and say, come back in a day or two. By staging it the way we have, we feel that we will have enough vaccine on hand where we can provide the most vaccine to the most people, thus allowing us to hopefully stop the spread of this H1N1. The clinical experts through the province are saying if we do a good job of vaccinating the population, we can potentially stop the spread of this by the end of December. If it takes us a while to get the vaccinations done, or if there's poor uptake, we could be dealing with this upwards to the end of May. So hence why we're doing such a large media campaign, public campaign around getting the information out to people about getting the H1N1 shot. The clinical experts have shown that it's 99% effective, and there's been very few side or adverse events to it. They're finding through the people that they're giving the vaccine through already, the clinical trials to the human population across Canada as well as the United States, Australia, and Chile, that the efficacy of it is really good. Most people are building immunities to the H1N1 after receiving the vaccination within 10 days. So it's a great opportunity for us to stop the spread of this unknown or this illness that we haven't dealt with before.
And I noticed here today that healthcare workers are getting both at the same time, seasonal and H1N1. Will that be for everyone the same?
Actually, once we get into our mass immunization clinics, we will stop providing the seasonal. A couple issues is that we really want to make sure that we're providing the best service that we can. By adding 2 vaccines at the exact same time, it does open the opportunity for a potential error that we do not want to have to put any of our residents through. So no, we will be offering the seasonal and the H1 to our healthcare workers because it's in a very controlled environment. It's one person at a time versus a mass immunization clinic where we could see upwards of 2,000 to 3,000 people. So what we'll do is we'll do the H1N1, and part of the rationale for that is we're starting to see an increase in the H1N1 and a decrease in the seasonal flu. So try to protect the people to the virus that's around and try to do that as effectively and efficiently as we can. Once we're done the H1N1, depending on the epidemiology in the province, we may start up seasonal flu campaigns again. The H1N1 is a universal vaccine, so it's free for everyone. The seasonal flu for all high-risk groups is free. For those that don't fit into that and still want it, there is a nominal fee, anywhere from, I believe, what we're hearing is anywhere from $15 to $20. The health region won't be selling the seasonal vaccine this year, so we're encouraging everybody to make contact with either their local pharmacist or their family physician. There's lots of the pharmacies and the family physicians that will provide that vaccine for sale.